What are the social determinants of health? Determinants of health are factors that affect our health. And in sociology, we look at health at the collective level. Population health is the health of a group of people, and the social determinants of health are the aspects of our social environments, how we experience life, the areas that we live, work, play, die, how those environments really get into our physiology and affect our physical and our mental health. Social determinants can be social factors, those categories that we can be classified into, such as our age, race, gender, ethnicity, socioeconomic status, which is a combination of your income, your total wealth, and your occupation. And in a medical sociology paradigm, we are not so much thinking about the health of individual people as we are groups compared to each other to learn more about our society and what it is about our society that produces inequalities when we compare groups, for example, age groups or gender groups or socioeconomic status compared against each other. And what we find in the literature is that there are very big differences by group. So what does it mean that our society is producing such a big difference, for example, in life expectancy between men and women, or the prevalence of certain illnesses by race or by geographic location? Our social environments also include our early childhood experiences, whether we've had trauma in our childhood or our adult life, whether we suffer from addiction, whether we're married, unemployed, how much education we have. All of these social determinants affect our health. So one question that comes up is, whose job is it to address the social determinants of health? We have health professionals and hospitals that are there to treat us when we get sick. But when you really move upstream and you look at the infrastructure of our societies, both physically and in terms of our culture and how everything is set up, our economy, social media, and everything in between, really, what is it about our society that causes both health and illness? And whose job is it to address some of those factors, if it's anyone's job? Could be education, the family, the government. Those are social institutions. The responsibility could fall on their shoulders. It also comes down to individuals. We have to kind of understand what's in our control and what's not in our control in terms of our well-being, and even our motivation to seek those things that are going to benefit our well-being is affected by broader society. So it's really interesting to think about our collective well-being and what illnesses we suffer from collectively, both physically, mentally, and even emotionally and spiritually. If we think about our collective health, it's not something that can truly be addressed by the medical model, because the manifestation of disease happens long before we would end up in a hospital. So think about your role in the social determinants of health. There are many organizations, businesses, healthcare organizations, but also nonprofits and all sorts of activist groups that are seeking to address some of the social determinants of health. You have emergency preparedness professionals and public health professionals that work to try to understand those root factors in health. And at the end of the day, there are some fundamental causes of disease in a society, and it really centers around inequality. When you have inequality and unequal distribution of resources and power, it tends to be disruptive for the well-being of the collective. Learn more at widespreadwellness.org. We've got coaching available and all sorts of practical tools to help you or your organization address social determinants of health. Find an appropriate outlet where you plug in, where you can actually play a part in improving our collective well-being while nurturing your own well-being at the same time. Have a beautiful day.